It's the #1 killer of men and women in the United States today. It strikes every 37 seconds and is responsible for more than 2,000 American deaths each day. Heart disease is known as the silent killer, and medical experts say it's crucial to be educated about personal risk factors for heart attack and stroke.
There are a number of personal risk factors that put us at risk for heart attack and stroke. These include cigarette smoking, high blood pressure, elevated cholesterol, type 2 diabetes, other things like being physically inactive, weighing too much, eating not a heart-healthy diet, and personal stress can all put us at risk. If you have a male in your family under the age of 55 or a woman under the age of 65 with heart disease, you're also at increased risk. When you combine any of these risk factors like diabetes and being overweight and having high blood pressure, again, your risk becomes even higher.
Despite efforts by some national organizations to bring awareness of these risk factors to the forefront, many Americans are at great risk of developing heart disease and do not even know it.
We're all at risk for heart disease. Those, however, with a family history are at much greater risk than those who don't have a family history. The good news is, though, our lifestyles are very amenable to change, such as treating diabetes, lowering our blood pressure, becoming more physically active. So we can make big changes in our risk factors, even if we do have a family history. It's never too early or too late to control our risk factors.
Healthcare providers agree that awareness is the key to prevention and early detection of heart disease and stroke. For the past 15 years, the Preventive Cardiovascular Nurses Association has been committed to educating and promoting the important role of nurses in the prevention and treatment of this national epidemic. PCNA takes a hands-on approach by engaging patients to identify personal risk factors, helping them to implement lifestyle and behavioral changes and seek the proper medical therapies. PCNA believes these combined strategies can reduce their risk for heart disease and stroke.
It is important to know your numbers. For example, your cholesterol values, your blood pressure, and blood sugar. This is critical in making decisions about treatment plans. Changes in diet and exercise can have an extremely positive impact on all these cardiovascular risk factors. For example, trying to walk 15 minutes every day can lower your triglycerides and improve your blood sugar and blood pressure.
To decrease my risk for heart disease and stroke, I learned how to change my diet and exercise routine. I've worn a pedometer and walked almost 10,000 steps every day for the past 5 years. I've lost 10 pounds and I reached my cholesterol and blood pressure goals.
Medical experts say that because children often mirror the behavior and lifestyle of their parents, they may also be at risk of heart disease when they enter early adulthood.
Our children carry our genes, but they also are greatly influenced by our lifestyles. Physical inactivity, being overweight, eating foods high in saturated fat, lots of fried foods, lots of fast foods, will greatly increase their risk of heart attack and stroke. Making those kinds of changes within our family environment are critical. Certainly, preventing heart disease is a family affair. Our future is very bright. We really know how to prevent heart disease and stroke. Changing our lifestyles is really the critical and the key component to a healthy life. We are all predicted to live well into our 80s, and if we're going to live that long, we may as well live it well. The changes we make now and that we maintain over our lifetime will really help us live well for our lifespan.
PCNA plays a major role in the nation's current healthcare system by providing comprehensive and effective cardiovascular disease risk reduction programs. Many nurses have the education, expertise, and the time to provide these services.
PCNA plays a very important role in the development and dissemination of national guidelines and other continuing medical education programs for nurses. It is our mission to educate nurses and to improve and expand their role in treating and identifying persons at risk in this international epidemic.
The Preventive Cardiovascular Nurses Association was really developed by nurses to train nurses to prevent and manage cholesterol. Over the past 15 years, we've dealt with all cardiovascular risk factors, and we reach 1 million individuals annually. We are known for developing educational materials for both healthcare professionals and the general public, reaching about 300,000 people. PCNA believes that we can touch many more lives and advocate for important causes if we partner with other organizations. PCNA partners with large organizations such as the American College of Cardiology, the American Heart Association, and the American Nurses Association, all of whom are committed to preventing cardiovascular disease. PCNA is really committed to working with individuals across the lifespan. For example, we advocate for better nutrition in schools to prevent overweight and obesity, to increasing physical activity in schools, and for the older adults, we recommend high blood pressure monitoring in order to increase blood pressure control.
Statistics show that nearly 1/4 of Americans have some form of heart disease. Through prevention and education strategies, PCNA is committed to helping Americans protect their hearts and live healthier, longer lives. Preventive Cardiovascular Nurses Association. Cardiovascular risk reduction leading the way in prevention. Visit PCNA.net.